So media is really an important part of the situation, and for a while I think we underappreciated it because children get a lot of information and there's a lot of messages sent there, whether we realize that or not. And the really big part around the childhood obesity is the food messages. Too often media or watching TV or playing a video game, people think of, oh, the kid is sedentary, they're not active and running and playing. But the missing part is that there's so many messages on TV, even on the internet, to eat, to consume, and eat when you're bored, because eating looks fun. People who are eating, whether it's French fries or sodas or whatever, are having fun. It looks like a good time, it looks safe, and they're cheap. So there's a lot of mindless eating that is encouraged and promoted really through media. And when you look at children's television, look at cartoons and all the commercials that go on, it's for toys, and the food is sugar sweetened beverages and snacks and fast food and sugary cereals and all kinds of, not that healthy number of items, which really prompt people to think of eating. So that is a really big concern when you look at the fact that media is a big role in the whole obesity equation. But again, it's not from the sedentariness in terms of lack of activity, but really from promoting, in a sense, mindless eating. There's very few dollars in terms of media and messaging marketing using Big Bird to promote eating spinach, as opposed to, Shrek or whatever your recent movie commercial is that's promoting French fries and fast meals and Happy Meals. This country, the public health community, the White House, pediatricians, parents are really trying to improve the options for parents to make healthier choices. At the same time, the influence of food production and sales in this country is enormous. The billions and billions of dollars behind food manufacturing and sales in this country pales in comparison. Far more probably than the influence tobacco ever had. So that is a key part of this equation, that there's a huge corporate entity behind increased consumption of food because it makes money, whether it's healthy food or unhealthy food. Unfortunately, most of the big money is made on unhealthy food. Think global, act local, because you need to know what your local barriers are, as well as what your local resources are for this. So we've been able to engage our pediatric practices that are very organized in a practice network for both research, but in this case, education and training of pediatricians. So that's a huge asset. We can get information out. We're partnering with our local PBS broadcaster, WXXI, to take some content material they've already developed that are geared toward kids and teens around healthy eating from grants that they've received, but the university and the Department of Pediatrics has consulted on for content, and get that information out to pediatricians, whether it's giving them links to their practice webpage, sending them DVDs on continuous loops that they can use for their own media in their office. They have a TV or DVD player in their waiting room. So we've been able to link, in this case, a positive use of media to get out healthy messaging really in a cheap, inexpensive way with our asset. The barriers are that there's still far more kids watching the Cartoon Network and these other options than maybe they're watching PBS, but we know through PBS where parents can be targeted, where grandparents can be targeted, and at certain times. So that's an advantage that we have in this community of saying, if we're going to try to do some of this and get this message out to a certain population, we know at least some venues where we can go, and we have a community partner that's there with us.